just so that way we can get you guys all checked in and going on time. Okay. All right, if there's nothing else, we'll go ahead and get started here with the Kahoot. And I will read the questions to you. If it bothers you that I read the questions, then just message me and I'll stop. How does the onset of pubertal growth spurt compare in girls and boys? In girls, it occurs about 2 years before it appears in boys. In girls, it occurs 3 years before it appears in boys. In boys, it occurs about 1 year before it appears in girls. It is about the same in both boys and girls. Yes, girls before boys, always for puberty. If that's not happening, and a girl gets to the age of 15 and they still don't have their period, then they need to see endocrinology. Okay. But yes, girls go through puberty typically before boys. Good. Okay, a multiple select. What activities are appropriate for a 6-year-old child? Hopscotch, jumping rope, riding a bike, or competitive sports? Yes, no competitive sports yet at 6. Okay. Good. At what age should a parent expect to have major conflicts over independence and control with their child? 11 to 20, 11 to 14, 15 to 17, or 18 to 20? And these are all years. Think back to when you were a teenager and when you were having the most conflict with your own parents. Okay. So yeah, 15 to 17. What stage are 15 to, well, are adolescents in for like Erickson's development?
Identity and confusion.
Yep, identity versus role confusion. And think about a teenager. You're trying to figure out who you fit in with, who you're going to be, what you're going to do with your life. A lot of things. Good. For your exam, know your developmental theorists, all of them. However you can memorize it, figure that out, because there's going to be a lot of theorist stuff. Okay. There's a handout on that. I think it's week 2. There's a nice handout that breaks everything down for you. Okay, signs of the onset of puberty in girls. Development of breast buds, shoulders widen, pectoral muscles enlarge, voice deepens, breasts grow smaller. Yes, breast bud development. That's your first sign. Good. The onset of puberty in boys is characterized by voice changes, testicular enlargement, growth of dark pubic hair, or increased size of penis. Testicular enlargement is your first sign. Think of the Tanner staging. You guys remember seeing that in your book? So the very first thing that you're going to notice is that testicular enlargement. Okay. That's for male puberty. For female puberty, it's breast bud development. That's your first sign. Okay. the voice does change, you know, kind of around that time, but that's not your very first sign of official puberty. Okay, what do we use to determine if a female has reached the age of menarche? Tanner staging, determine breast size, Maslow, or presence of pubic hair. Tanner staging, I kind of just gave that one away for you guys. Okay, but that's how you figure out if we're getting closer to puberty development, closer to menarche in females. Okay. If you guys have any questions about any of these answers, you can just unmute and ask. Okay. Child goes to the ER with low fever, pruritic rashes, and open oozing papules. Nursing care includes use universal precautions, enteric precautions, wash hands before and after leaving the room, wear an N95 mask, and use a negative pressure room. Okay, so low fever, itchy rash with open oozing papules. What's a papule? Is that a flat lesion or a raised lesion?
Raised.
Yes. The other thing that I could say to maybe give you guys more of a hint would be a vesicle. It started as a vesicle. So with knowing that they had a low fever, it was an itchy rash, and they became open and oozing papules, and they started as vesicles. What are you thinking this rash might be? It's a childhood illness.
Chickenpox.
Perfect. Good job. Yep. Chickenpox. Chickenpox are highly contagious. We don't typically see them that often, but we're starting to see them more often because of the drop in vaccination rates. Okay. So yes, if you have a patient with presumed chickenpox, they need to be in a negative pressure room because it's airborne. Precautions. Okay. And you have to wear an N95 mask as well. Okay. Any questions about that? So chickenpox is airborne and measles is also airborne. And tuberculosis is airborne too. Okay. The source of injury, whether intentional or unintentional in adolescence, is associated with poisoning, motor vehicle accidents, drowning, or homicide. Most common source of injury, it should say. Yes, motor vehicle accidents. Good. Okay, a 9-year-old's friend tells him soccer is a dumb game and he should play baseball. Okay, peer acceptance is very important at this age. Peer groups change at this age. His peers will accept his choices, or peer groups are known to be bullies. This isn't really a question, kind of a statement, and then what the statement means. Yeah, so peer acceptance is very important at this age. So school age kids, they want to do what their friends are doing. And if their friends think a sport is not cool, or they say that they should play this sport instead, or all of their friends played this sport, they'll want to switch their sport to be with their friends. Okay. So peer acceptance, they're trying to be accepted by their peers. Okay, during admission, the father of a 16-year-old says, "We are Buddhist. Culturally competent care includes use of internet to search for Buddhists and beliefs, ask if there is a preference in their care, access the child's need by asking questions, discuss concerns with the 16-year-old." Yes, ask if they have a preference in their care. That's going to be the answer to any sort of wanting to provide culturally competent care. Okay, just ask. It's better to ask than assume something and then have there be an issue. Okay. Okay. When teaching sex education and contraception for adolescents, what should the nurse consider? Teenagers today are knowledgeable about reproductive anatomy and physiology. Both sexual activity and contraception require planning. Teenagers who are pregnant do have hostility towards parents, and then teenagers need contraception education in oral and written form. Yep, provide it in multiple ways. So telling them about it orally, and then also giving them a written form to take home with them. Okay. Most teenagers probably try to acquire most of their information from, TikTok or their friends or other social medias, which is not the most accurate way for them to acquire that information. Okay, so try to work with the parents on making sure that these teenagers are getting the most accurate information from you as the nurse. Okay. Hang on here, I have a chat below. Let's see. Make sure I wasn't missing a question. Okay, that's okay. Just try and keep up with the answers and things. Okay, multiple select. The management of an adolescent obesity should include keep a 24-hour diary of all foods that has been eaten in one day, incorporating their favorite foods into the diet, encouraging diversional activities during meal times, using nutritious foods as a method of reward. Okay, so we don't really want to use food as a reward, okay? Because that's not always the best habits to kind of set up. And then diversional activities during meal times, you still want them to eat regular meals. We just want them to make healthier choices. So we don't want to try and distract them or have them do other things during their meal time. Okay. So keeping a 24-hour diary of all foods, that usually works pretty good. Sometimes there's some difficulty with that if there's an eating disorder going on. Sometimes that can kind of worsen the eating disorder. So if you're suspicious of that, kind of keep that in the back of your mind. And then try incorporating some of their favorite foods into their diet. So let them work with you on what they're going to do for their weekly meal planning kind of things. Okay. Good. They are looking at adding for kids who are morbidly obese or severely obese, adding in some of the medications for weight loss in the pediatric population, but they have not done that yet. Okay, which action would improve dental health in the school-age child? Limiting brushing teeth to 3 times a day after meals, encouraging the child to floss when they are able, the parent brush the child's teeth and do it properly, Have the child consume fruit juice rather than soda. Yes. Encouraging them to floss when they're able. Fruit juice rather than soda, that's not really a better alternative. They both have a ton of sugar. So I usually say don't do fruit juices at all, or soda at all. And then independence wise, a school age child, it's going to be a total fight for them, for you as a parent, to try and help that child brush their teeth. So it's better to allow them to still have some of that independence in brushing their teeth, just making sure you're reminding them. And what's recommended is at least twice a day. You don't have to do it 3 times a day. Okay, an 8-year-old girl says that she has cancer because God is punishing her for being bad. So suggestive of failure to develop a conscience, a belief that forms as a basis for most religions, suggestive of excessive family pressure, or a belief that is common at this age. So it's a belief that's common in school age kids. So if something is happening with their health, then a lot of times they think it's because of something that they've done. Okay. A 6-year-old needs to get a chest x-ray. What explanation is the best? Technician is going to take an x-ray of your chest. The technician will use a large camera to take a picture to look inside. The x-ray does not hurt. This picture will show us the lobes of your lungs and any consolidation. Yes, large camera to take a picture to look inside your body. That's the best way that you could explain it in a way that a 6-year-old could understand. Okay. And they'll probably ask you, will it hurt? And you can say, no, it won't hurt. But that's not the most accurate way to explain the procedure to that child. How can you get an adolescent to be more receptive to talking about their health and sexual exploration? Ask direct questions, have the parents leave their room, offer responses that they can choose from, or have parents answer the question. Yes, have parents leave the room. That's going to be the way that you get typically the most accurate, truthful answers. And that child feels that they can be more open with you too. Okay. I forgot to ask you guys, do you want to take 2 10-minute breaks, or do we want to just get out early like last week?
Early.
Okay.
I like.
Everyone good with that? Okay. So 4:55 Eastern time, you guys all have to stay on till to get full attendance credit. Okay. Child has knocked out a tooth. Where should the tooth be placed to transport to the dentist? Cold milk, warm salt water, cold water, a dry, clean jar. Okay. Cold milk. Think about a tooth. We need good calcium to have good teeth, right? So by putting it in cold milk, it's more likely that they could get that tooth back in place. Okay. A nurse is planning care for a school-age child. should know which thought process is seen. Animism, ability to conserve, magical thinking, thoughts are all powerful. School age child. So it's ability to conserve, okay? Think about Piaget. Okay, they're cognitive theorists. Okay. School age kids have already gone past their magical thinking. That's more of a preschool thing. Okay. Which stage of Erickson's would you use for a school age child? Trust versus mistrust, autonomy versus shame and doubt, initiative versus guilt, industry versus inferiority. School age. Okay, industry versus inferiority. Okay, autonomy versus shame and doubt, we're pretty close. What age group is that one?
Toddlers,
Toddlers.
schoolers.
Yep, toddlers for that one. Okay. So we're mastering our skills as school age kids. That's being industrious. And if we don't master our skills, then we feel inferior. We have like poor self-esteem. Okay. School age children's moral development conforms to the rules to please, fear of punishment, doing wrong or right behaviors are based on the consequences, or has not developed yet. Yes, conforms to the rules. So school age kids, they want to follow the rules to make others happy. Okay. Preschoolers are the wrong or right behaviors based on consequences. Okay. Okay, multiple select. Anorexia nervosa is characterized by a fear of weight gain, unrealistic body image, severe calorie restriction, and vomiting and purging. Okay. Vomiting and purging, what does that go along with? Not typically anorexia.
Bulimia nervosa.
Bulimia nervosa, good. Yep, good. And the fear of weight gain and the unrealistic body image, that also goes with bulimia, but with bulimia, you don't see the severe calorie restriction. You usually see them eat, and then they throw up after eating. Or they might eat normally and then throw up after that. Okay, what behaviors would you see with a child with bulimia? Okay. I forgot that this was the next question. Exercising excessively, binge eating and purging, withholding food, use of laxatives. Binge eating and then purging. So they eat and eat and eat and then they throw up. Okay. What is an adolescent's heart rate? 45 to 85, 65 to 105, 55 to 90, 60 to 120. There is a handout on this from week 1 with normal pediatric vital signs in that week 1 announcement. Okay. 55 to 90 for adolescents. Okay. So know your normal vital signs too, because that's going to help you figure out things on questions for the exam. Okay, when talking with an adolescent regarding personal health concerns, which is most important? Using the same slang as the child uses, let them know you must tell their parents what they share, tell them to discuss it with their peers, or give them an opportunity to express their feelings open and honestly. Yes. And what do you have to tell parents as a nurse, like legally, from adolescence?
Legally, anything prudent to their actual health need. So like, well, pretty much everything because they're under 18.
The age of
But
consent,
not,
So not technically.
like suicidal
Yes.
and harm.
Homicidal, like so safety concerns, right?
Self-harm of self, they have to report that.
Yep.
Of anyone else.
How about pregnancy? In some states, parents don't need to be told about that. If that child does not want their parent to know, in some states, as long as they're healthy pregnancy and they're not having any major complications, then you don't have to tell parents about it. Okay. Or contraception stuff too. That kind of falls in that category. STD stuff, same thing. Now, I always tell kids if they come to me and they want STD testing or a pregnancy test, okay, I can do that and I don't have to tell your parents the result, or that you came to me to have that done. But when they get their insurance explanation of benefits, it's going to show on there that they had STD testing done. So the parents will still potentially find out if they look at that, but that is not you disclosing that information to the parents. Okay. And it's a little different for each state. So there might be some extra added things in certain states, but for the most part, it's safety driven. So is the child safe? Are other people safe from the child? Or like pregnancy, contraception, STD related is what you, or well, I guess I should say safety related things are things that you have to disclose. Sorry, I probably just totally confused you all. STD, sex stuff, pregnancy stuff, you don't have to disclose in every state. Okay. Did I totally confuse all of you now? No? Okay. So I just usually tell teens, when their parents are out of the room, whatever they say to me is confidential, as long as there's no concern for safety of themselves or others.
So hold on, I have a question. So you don't, like, if the child was to tell you that they're gonna be at home or whatever, you don't tell that to them, like, oh, I'm calling, child services up here, or
So, yeah, if I'm concerned for the child's safety, then no, I don't always disclose that to the parent. Like I will step out of the room and call DHS and try to keep the parent and the child there. If it's a concern that's maybe happening not in the home, sorry, I clicked the next button while you were asking that question. So if it's not necessarily the abuse isn't happening in the home of the parent that's there, but there's concerns for abuse in the other household, and that child wants me to inform the parent that I'm going to get a hold of DHS, then I will. But yeah, definitely if there's a concern that that parent is a potential abuser, I do not disclose that information to the parent that I'm going to be calling DHS. You don't have to tell anybody technically that if you're calling DHS, but I usually am upfront with a parent if it's potentially the other parent's home that this is happening in. Does that make sense? But yeah, you don't have to tell people that you're calling DHS on anything. So if you want to remain totally anonymous when you call, you can. Okay. Good. Okay, so this question was, a parent says their infant put everything in their mouth. Okay, well, this is supposed to be school age kids, but this is an infant question. Based on Freud's theory, how would you respond? So infants don't do that. I will tell the primary provider. This usually happens at 2. And infants explore the world using their mouth. So remember Freud, it's the oral phase, right, for infancy. And you can think about that. They're, as they're starting to crawl around, they're putting things in their mouth, but also they're getting all of their nutrition through their mouth. That's kind of how I remember the oral phase for Freud. Okay. They're getting their pleasure through their mouth by eating or by exploring the world through their mouth. And like I said, make sure you guys know your theorist. That's going to be pretty heavy on this exam, okay? Multiple select, what could be a sign of potential child abuse? Inconsistency between the injuries and the history. Child is afraid to talk, different stories from the child and the parents. Parents are very concerned about their child's injuries. And it was multiple select. Yes, good. So if you're concerned that like a kiddo has a weird bruise or something and it might be child abuse, and the kiddo's not really been talking as you're examining them and talking to them, then ideally I would try to have the parents step out of the room so you can talk to that child by themselves. If a parent or someone is an abuser, a lot of times you'll get, this doesn't automatically mean that they're an abuser if they're refusing to leave the room. But a lot of times you'll get a lot of pushback on that. And that can also be eye-opening as well. But the biggest thing is you guys as nurses, if they're telling you a story and it doesn't line up with the type of injury that's happened, that's a major sign that there's probably some sort of abuse that happened. Okay. And if you're concerned at all, most states have protections that if you call DHS and it's unfounded, that, you don't get in trouble for doing that. But if you're concerned at all that there's abuse going on, calling DHS is your best thing to do. Okay. Okay. In the school age conflict of industry versus inferiority, what does industry mean? Making friends, mastering a task, speaking to adults, helping mom at home. Yes, mastering a task. Being industrious is mastering a task. Okay. Good. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? Dry skin, decaying teeth, intolerance to cold, constipation, which does not indicate anorexia nervosa. Decaying teeth, what would that be more indicative of?
bulimia.
Good.
Because of the
Yep.
acidity.
Yep, exactly. Because of the acidity of the vomit. Yep, good. Okay, cooperative play. Kids working together in order to reach a common goal. Kids play near each other without arguing. Kids create play to teach life lessons such as sharing. Kids play while their parents work nearby. Okay, kids working together to reach a common goal. So they're playing the same thing. Like, okay, they're playing checkers. They're both trying to win. They're playing with Legos and they're both trying to build, a castle. So things like that. They're working together to reach a common goal. What does moral development involve? Changes in thoughts regarding right and wrong and consequences. Only development in adulthood, stealing and cheating as a child, or arguing with parents. Yes, changes in thoughts regarding right and wrong, and then their consequences. That's moral development. Okay, good. Developmental milestones are important to observe because they are clues when to institute early intervention and prevention. Comparison of children help to understand personalities. They indicate future success or failure, and they shouldn't be allowed to pass from first grade to the next. Yes, they're clues when to start that early intervention or try to prevent them from continuing to be developmentally delayed. So there are lots of public health programs. I live in Iowa and we have a program for kids that are less than 5 years of age. To like be able to access preschool or to be able to work with speech therapy or occupational therapy if they have developmental delays. So you guys will have some sort of program like that in each state that you're in. Like Head Start is a preschool program, that you can get kids into if they're developmentally behind sooner than typical kids when typical kids start preschool. Okay. So the earlier you can intervene, the better, the less likely that they'll continue to be behind their entire life. Okay. Which of the following immunizations is given in the adolescent stage? Varicella, herpes zosters, HPV, or seasonal influenza? Okay, well, I think that this should have two answers in my opinion, but okay, HPV, or human papillomavirus, that is a vaccine that's given during adolescence. So you can start technically at age 9, which is actually school age, if that kiddo's high risk for, sexual activity at an early age. That's kind of your risk factor, or they're immune compromised or something. Then you want to do it earlier. But usually this vaccine is done at 11 or 12 years of age. You want to get them fully vaccinated before they're having sexual activity because HPV is transmitted through sexual contact. Okay. HPV causes numerous types of cancer. Because we started doing the Gardasil vaccine or the HPV vaccine, those cancer rates have dropped significantly. And so has the amount of HPV. Okay. Now you can do the HPV vaccine up until the age of 45. And so they recommend doing it for older adults as well. Okay. The other vaccine out of these 4 that I think would be also given at the adolescent stage, which do you guys think that would be?
Influenza.
Yes, influenza. Yep, that would be the other vaccine that I would also give in the adolescent stage. So I think that this one will be changing to a multi-select question. Varicella, that is what? What's the other name for varicella?
Chickenpox.
Yep, good, perfect. Chickenpox, and that's given when they're 12 to 15 months of age, and then a booster at 4 to 5 years of age. Okay. The herpes zoster, what vaccine is that? Does anyone know? Shingles, yes. Yep, so that's elderly population. Any questions on those vaccines? No? Okay, we'll keep going. Okay, ADHD most likely involves which of the following? Fear of new things, bouts of panic and intrusive thoughts, difficulties with reading, motor control, and lethargy, inattention, distraction, impulsivity, and hyperactivity, experiencing sad thoughts, social withdrawal, or be tired. Yes, inattention, distraction, impulsive, and hyperactivity. Doesn't mean that kids have all of those symptoms if they have ADHD. They may just have one or two, but those are kind of the most common signs of ADHD. Okay. Multiple select. An adolescent has been brought to the ER with a drug overdose. What are your initial questions to ask? Do you want rehab? When did you take the drugs? What type of drugs did you do? How did you take the drugs? And this was multiple select. Okay. Yes. When did you take? What did you take? How did you take it? That guides your initial steps. Correct? Now, asking them if they want rehab or they want help with their drug addiction or their overdose, right? That may be a question that's asked or discussed, but that will happen later, not initially. Okay. Nine-year-old recently has stomach pains in school. The child has also been aggressive and stubborn. What is the reason? Lack of adjustment to the school environment, signs of stress, cognitive delays, or attention seeking. Signs of stress. What does that kid sound like they're kind of experiencing maybe? Frequent stomach pains.
A little bit of anxiety.
Yes, exactly. And a lot of times in kids, you'll see behaviors change with anxiety or depression or ADHD. Okay. So you might see a kiddo who wasn't really aggressive. They might start being aggressive. They start being more resistant to doing their schoolwork, having more behaviors, things like that. Also, you'll see behavior change things with child abuse situations as well. So keep that in mind too. Okay, last question. Some multiple select. Nurse teaches a safety course in school-aged children about their community. What should she include? Fear of strangers, water safety, teach them how to use a microwave safely, and appropriate car restraint. So school age kids should already have that fear of stranger, right? Or be aware about strangers. That should be something that's taught in what time frame do you think?
Tyler,
Toddlers.
Like preschool age, right? Probably kids. Yep. Water safety, the appropriate car restraint, and teaching them how to use a microwave safely. So you're teaching them how to use a microwave in hopes that they're not utilizing the stove or something while the parents are gone. So by teaching them to utilize the microwave, then it's less likely that they're gonna have, burn injuries or something. Okay. Water safety is gonna be a big one in school age kids. So swimming lessons, using a life jacket, things like that. And then the appropriate car restraint. So whether they need to still be in a booster seat or if they can sit with their back all the way to the back of the seat with their legs at a 90-degree angle with their lap belt, then they can just use the lap belt. Also making sure that you're telling school age kids that they can't sit in the front seat until they're at least 12. Okay. Any questions on that one? No? Okay. I will stop the share then here and we'll start the PowerPoint. Okay. Hang on one second, I have a chat too.
Ms. Becker,
Uh-huh.
one of our students, I believe Brianna, she was kicked out. She has a storm near her house. From what I know, I am not a Florida native.
Okay.
So she stays fur in like the Hicks, so to speak.
Okay. Yeah, that's fine. If they get kicked out as soon as they can come back in, they can. Otherwise, as soon as they can. Otherwise, then if they're off, they're off. The
Oh,
attendance unfortunately just doesn't get counted, but I understand weather happens.
I'll
So.
let her know.
Okay, thank you. Okay, I'll go ahead and start this screen share here. Okay, can you guys see that? Yes? Okay. I'll put it in the slideshow. Oh, hang on, you guys popped to the side too. Hang on. Sorry, I know my screen's paused right now. second. Okay, can you see that now? I don't know why it stopped it when I was in the other view. We'll try again and see if it stops it again. And if it does, then we'll just not. Okay, is that working now for you guys? Yes? Okay. Alrighty, so we'll start with growth and development for school age children. Okay, so school age is generally 6 to 12 years of age. Okay, that's going to be your range. So when you're talking about a school ager, that's going to be the age range. Physiologically, it begins with your first loss of your first set of teeth, so your baby teeth. Okay, that's when school age physiologically begins. And then it ends with puberty and you getting all of your permanent teeth. So if somebody doesn't start puberty until they're 13 or 14, and then that's when they have all their permanent teeth, then that's when school age stops and they become adolescents. You're going to have more of a gradual growth pattern. So they're not going to have that really sharp linear curve. It's going to be kind of more of a gradual to then level out during adolescence typically. Okay. Going to be progress with both physical and emotional maturity. In middle childhood, so school age, usually their height is going to increase by 2 years. They're going to gain from 6 years of age to 12 years of age on average, 1 to 2 feet in height. Your weight is going to double over that time period. Okay. And girls and boys are going to differ little in size. So boys and girls in school age are about the same heights. You're not seeing that drastic difference in height like you see in adolescence between males and females. Their movement's going to be more coordinated than preschool age. You'll see them playing in more competitive sports and being better at competitive sports than if they started those in preschool age groups. Typically lose their first tooth around age 6. Now there's some variation on that, but that's the typical pattern. There's going to be more changes in their facial appearance. And then their height is, their head circumference is going to reduce related to their height. So their head is going to be more proportionate to the rest of their body. Until school age, usually their head proportion, it seems a lot larger than their body. And they're acquiring more muscle tissues. Their bladder capacity increases, so they're not having to go to the bathroom as often. Their heart is smaller compared to the rest of their body, whereas in preschool age and toddler age, their heart is taking up almost half of their chest. Their immune system is increasing. They've encountered a lot of different viruses and bacteria, so their immune system is starting to function and recognize those things and start fighting that stuff off before they get really sick, like they would have when they were infants or toddlers or preschool age kids. Okay, child that's starting to have behavioral changes with physical symptoms could be showing signs of distress or stress. So you want to be checking that kiddo out, talking with parents about kind of what's going on. Prepubescence, so this is pre-adolescence. Adolescence. This is typically the 2 years before they're age 13. Okay. For girls, it's from ages 9 to 12. Okay, which is about 2 years earlier than boys, which is about ages 12 to 14 in boys. Okay. Average time in girls now is about 10 years of age, and average time for boys is about 12 years of age to start going through puberty. Okay. Your assessment for an adult or for a school age kiddo is, you're going to look at doing more of the things like what you would do with an adult. You're going to inspect, you're going to auscultate, you're going to palpate or percuss, and then palpate, looking at lymph nodes, assessing the hypoglossal nerves. So you're going to have them stick their tongue out. Okay. And to figure out if it's upper airway, like say you have a kiddo who's sick, to figure out if it's an upper airway noise versus the lung sounds, you can place the stethoscope over the trachea. And if you hear a lot of noises up here, but you don't really hear the noises in the lungs, that tells you that it's more of an upper airway issue. Sorry, I have a chat here. Yeah, if you guys have to use the restroom, just go ahead and go. You don't have to chat me that's where you're going. If there's something else going on other than just a quick restroom break, then obviously let me know. But okay, psychosocial development. So latency period for Freud, they're following their heterosexual fascinations that starts to occur at puberty. Okay, so this is kind of where things are level or tranquil. Relationships typically are more common with same-sex peers during the latency period. So they're kind of bothered, or they don't care about their other opposite sex peers at this time. Okay. Sense of industry. So this is industry versus inferiority for Erickson. Okay. So this is where they're trying to become masters of different skills. Okay. And when they master those skills, then they feel a sense of independence and they feel good about themselves. If they're not able to master those skills, then, they're going to feel inferior, have poor self-esteem. They're seeking peer approval. That's a huge piece of the school age kids. And like I said, if they're not able to do those things, then they're feeling inferior. They may have a hard time making friends. All of that. Piaget, that's the cognitive theorist. They're in concrete operations. So they use thought process and experience from different events to correlate with their actions. Sorry, my dog's getting on the camera now. They're developing and understanding relationships between things and ideas. They have more conceptual thinking, so they have some ability to make judgments based on different reasons or different things maybe that they've experienced. And they are masters of conservation. Okay. So they understand the conservation piece. That's where you take two slightly different cups. So a short rounder cup and then a tall skinny glass, and you fill that with the same amount of water, and they understand that that is the exact same amount of water. Okay. Or, a pound of bricks and a pound of feathers, which one weighs more. They understand that they're both a pound. Okay. So prior to school age, they're typically not understanding that conservation. And here that's kind of explaining that. So we'll skip that phase. Social centricity. So that's when you're not feeling well and you're resting on the couch with your eyes closed. And then does your child bring you that favorite blanket? So you as the parent aren't feeling well, you're laying down, they're trying to figure out something that you would like to comfort you, to try to make you feel better. So school age kids are figuring that out. Formal operation. Oh, and so that is, sorry. So concrete operational is the third stage. That's ages 4 to 7. So that's when they're understanding the conservation and the social centricity. Formal operations, this is the fourth stage. This is for ages 11 and 12, okay? What can kids do in the formal operational stage? Give me an example. So this is going to be your hypothetical situations that kids will start thinking about, you know, things that hypothetically could happen, and then multiple potential solutions and those outcomes to those hypotheticals. So that's what you'll see during formal operations. The moral development, so this is Kohlberg, so ages 6 to 7, so early school age. You're going to see your reward and your punishment, and that's going to drive their choices. Older school age, so 7 to 12, they're going to use, you know, they're going to try and conform to their peers to please others. They're going to use rules, and judgments are going to be more of what drives their decisions, okay? But it's going to be more influenced by their peers. Spiritual development, so they're thinking in very concrete terms in school age still, okay? They still expect punishment for misbehavior. We make a poor choice or a poor decision, we get a punishment. If we make a good decision, then we may get some sort of reward. And they're starting to desire to know if they have a religious family, their God, okay? Peer group is extremely important in school age kids as well as adolescents. They may change their interest in certain activities if their friends do not like those activities. Sex roles are also strongly influenced by their peers' relationships, okay? They're starting to kind of identify separate from their parents. Peers are starting to influence things more than parents are, but parents are still the main source of influence for kids in school age groups, okay? See a lot of bullying. You see, like I said, more formalized groups that they're fitting into or starting to fit into, competitive sports, things like that. Like I said, but parents are still the primary influence in school age kids. Play, they're going to do team play. They're trying to master things. They really want to master whatever they're doing. And if they don't master it, then that's where you can see maybe some hurt feelings or wanting to quit. They're starting to develop a sense of self, okay? So if their adults are successful in life, and then a lot of times at this age, you'll see those kids also start to become more focused on being successful as well. Kids are in school age group, they're starting to develop a body image. It's not as necessary or as important as when we get into adolescence, but they're starting to notice, you know, some changes with their bodies. So you can start to see anorexia or bulimia or kind of body dysmorphia things in late school age kids. Okay. So they're getting their socialization through school, but also in their family setting. Okay. And peer relationships, once again, are starting to become more important. I know I've said that like 10 times, but good for you guys to hear it again. Nutrition is still very important because if we're not getting nutrition, we're not able to develop and grow appropriately. So still very important. They are starting to have their preferences. They're wanting fast food. They don't want to eat what parents make in this age group because that's what their friends are doing. So still making sure that they're eating balanced meals as their parent. And then, you know, still sitting down to have supper as a family. My Plate is a good reference for exactly what they need for balanced diet options. that you can refer parents to. Health concerns related to obesity. So obviously this is becoming a huge concern. Obesity is a huge issue now in pediatrics because of the lack of physical activity and the increase in technology use at younger ages. So they, just like adults, have increased risk then for all the obesity, kind of overweight diseases that we see in adulthood. Now we're starting to see those in childhood. So hypertension, diabetes, high cholesterol, all of those sort of things. More taxing on our hearts, more taxing on our lungs, all of that. Okay. So early education on all of these adult things that can happen in kids who are obese is really important. And we don't at this point reach for medications with kids who are obese first. You're still going to talk about dietary things and exercise. Okay. Sleep and rest, the averages should be 9 to 11 hours during school age. But a lot of times you'll see school agers, depending on the age, can sleep very minimal amount of time. Kids 12 and up are usually more resistant, or excuse me, kids 8 to 11, usually you start to have troubles with getting them to sleep on time, that they're more resistant to going to bed. Whereas kids 12 and older, they're usually less resistant to bedtimes because they're exhausted. Sports and activities. They like competition at this age. They're using cell phones. They're having a significant screen time. Telling parents to limit screen time to 2 hours or less a day is ideal. I know that that's not happening in most all families, but that's the ideal recommended thing from the American Academy of Pediatrics. Social media, safety things, talking about that with parents. You know, that they're not having friends that they don't really know who they are on their social medias, or they're not having those things, or their social media accounts totally public for everyone who can see. Let's talk about those safety things as well. Dental health, so the eruption of permanent teeth starts to begin during school age time frame. Most kids have the manual dexterity, so they're able to floss their own teeth between ages 5 and 7. So start having them do that as soon as they can. Do that by themselves. If they're losing teeth early or losing, like having a lot of cavities, obviously that's a sign of poor dental health. So they need to be seeing the dentist more often. Okay. A malocclusion is when the upper and lower arches do not approximate. So these kids will likely have to have braces. A dental avulsion is the loss of that tooth. So you'll have to take that in. Then if the tooth is still okay and you find it, put it in that cold cup of milk, take it to the dentist, and hopefully they can reattach it. Otherwise they may have to have, you know, like a false tooth placed. Sex education, we need to start talking about this during middle childhood. So, you know, 10, 11 years of age, okay? The parents need to be involved in this, and the school as well, and you as a nurse, okay? So using the appropriate terms for all of our body parts, okay? Having open communication with parents can be helpful, okay? Answering questions appropriately. School health, so they need to have their routine physicals. They may be getting counseling services through school. And then that health appraisal, that would be their routine school physicals to make sure that they're nice and healthy to be attending school. Okay, and then obviously if there's any concerns that they need to be referred for some extra help or something, setting all of that up is something you could do as a nurse in a school setting. Injury prevention. This is a list. You guys can read it. Obviously, still motor vehicle accidents are the most common cause. Okay. Parents should be allowing that child to increasingly have independence from them, and supporting that child without stepping in as often as possible. Okay. Okay, I'm gonna take a break here because I actually have to run to the restroom now that I lectured my review prior to, so just hang tight. I'm gonna pause this and shut this off for a second. Okay, I'm sorry. Okay, can you guys see that again? Okay, I had to go all the way back to where we were. Okay, so school age kids with behavior components. So ADHD is obviously something that kids struggle with during school ages, usually early school ages when it's figured out. So kids who have ADHD, they look like kids who have a hard time staying on task. Maybe they can't complete their chores at home. They're having a hard time turning their assignments in or finishing their assignments. They're frequently interrupting class or easily distracted. So kids, parents can help kids with ADHD. They can, have them do a planner or something like that to help them keep track of all their assignments or things that they need to do each day. And for you as the nurse, the biggest thing that you're going to do is listen to all of the parents' concern and then help them kind of make a care plan for that child to be successful. Medication is also often used, is also often used during ADHD kids, especially early on, because they have a really hard time with impulse control and staying on task. So they might be on some ADHD medications like stimulants. Obviously, you as the nurse, though, are not making that choice. Enuresis, so this is bedwetting. It's either primary, so there's a cause, like a physiologic cause, or it's secondary to, them drinking too much fluids throughout the day, or, being really heavy sleepers and not waking up to go to the bathroom. So taking a detailed history and physical is a part of your assessment piece for nursing assessment. Then developing a treatment plan. So education, so making sure that they're sitting on the potty before they go lay down for bed at night, making sure that they're going to the bathroom before they lay down, making sure that they don't have water by their bedside, so they're just reaching over and chugging water in the middle of the night and then having accidents. Modifying behaviors. The most effective thing to do is actually a bedwetting alarm, which sounds kind of crazy. If it's happening at night, they just essentially it's like a little foam thing that's connected to a wire that goes to an alarm. They put the foam or the fabric piece in their underwear, and as soon as that starts getting wet, then the alarm goes off. That helps to wake them up to kind of realize that they're going to the bathroom. So hopefully they can stop and then go to the restroom. Reassurance also is pretty helpful to these kids and these parents. A lot of kids struggle with bedwetting or having enuresis. So just kind of allowing them to know that that's kind of a normal thing that kids will have happen, and that usually goes away by the time, you know, they're into adolescence. In caprices, this is repeated passage of stool. So this is like enuresis, but it's with stool instead. So they're having stool accidents. So obviously making sure that there's not some anatomic cause or structural cause for the encapricis. Figuring out what's causing the encapricis. A lot of times it's kids who are chronically constipated, and they've kind of lost that sensation. They're just kind of starting to leak stool. So fixing their constipation by encouraging them to not do dairy is a good one, because a lot of times dairy is significantly constipating to kids. Behavioral therapy, so cognitive behavioral therapy or some sort of psychotherapy intervention is also really helpful in treating encapricis, because they might be nervous about, you know, their stool going in the toilet and their stool separating from their body. You see that happen a lot in in toddlers and preschoolers, that they don't want to have to flush their poop. They feel like they're losing a part of their body doing that. So having a therapist work with them on kind of reversing that is helpful. And then, like I said, dietary modifications. Another thing is celiac disease. These kids tend to be more constipated as well. So making sure that they're not eating gluten. Okay. Question. A child has an avulsed tooth, so a tooth fell out. The parents are reluctant to try to reimplant the tooth, but what should they do to take that tooth to the dentist?
A.
Yep, cold milk. We've talked about that now a few times, but it really is something that works. Okay, any questions about school age kids? We've got about 30 minutes left for adolescence, so we'll get through what we can. Adolescence is obviously transition from childhood into adulthood. So there's a lot of changes that happen, okay? There's a lot of physical changes, cognitive, emotional changes, a lot of maturing that happens. And adolescence starts with the start of secondary sex characteristics, so puberty, and goes until the end of body growth, so usually 18 to 20 years of age. Okay, so primary sex characteristics are external and internal organs necessary for reproduction starting to function, okay? And then the secondary sex characteristics, these come from those primary changes happening internally, so those hormonal changes, so hair growth, breast enlargement, fat deposits. The secondary sex characteristics don't truly have a direct role in reproduction, okay? Boys, their first puberty change is testicular enlargement, okay? So it starts to become thin, more red, and then the increase in the looseness of the scrotum. So because their testicles are enlarging, their scrotal sac begins to be more full, okay? This typically happens between 9.5 and 14 years of age. First puberty change for girls are the breast bud development, okay? And it is totally normal for girls to have irregular cycles, okay, when they're first starting puberty. Usually after 2 years of having their menstrual cycles, they should be regular. And if that's not happening, then there's something else causing them to continue to be irregular, okay? Usually after breast buds, after girls start with breast buds, about 2 years afterwards, they're going to start their menses. And then, like we talked about, boys and girls need the doses of HPV. It's not always, so this is incorrect. So they start at age 11 or 12, okay, HPV. If it started before age 15, they just need 2 doses. If it started at age 15, the very first dose, then they have to have 3 doses. And that's because kids who they wait until they're 15, it's likely that they've already had some sort of sexual contact. So they need the 3 doses for a little better coverage. But girls and boys get the HPV vaccine. Here's your Tanner staging for both boys and girls. So take a peek at this. Sexual maturation, that also goes along with a huge growth spurt, okay? So 20 to 25% of their height growth happens during puberty, okay? And then usually 2 to 3 years after puberty begins is when you're gonna see that growth stop, okay? Obesity is more associated with the early onset of periods in females, but obesity in males doesn't necessarily affect their puberty timing. And there's voice changes in both sexes, not just the males. Okay, our psychosocial development, that's Erickson, okay? So this is identity versus role confusion. So they're trying to figure out their group identity, what group they fall into in early adolescence. So this would be, ages 12 to 15 would be early adolescence. They're trying to find a group to fit into. Otherwise, they're going to be alienated or isolated if they're unable to find that group. And then as they progress into later adolescence is when they're figuring out their personal identity. And then if they don't figure that out, they're going to have role confusion. Body image. This is very, very common in both boys and girls in adolescence. Okay, but obviously if we struggle with our body image, that can lead to depression. We're going to have more emotions because all of our hormones are raging. Okay, and then any signs of suicide should be taken very seriously. So these signs of suicide can obviously be self-harm, social withdrawal, talking a lot about death, changes in appetite, more irritable, or sleep disturbances. Doesn't mean that because they have those things, they are actively suicidal, but for parents and you as a nurse to kind of be aware, okay? You guys can read that one. Relationship with parents, so it changes more from protection and them being dependent on you to kind of equality during this time period. So instead of you having to kind of be their person that they depend on to stay alive, they can kind of keep themselves alive and function, independently from you in adolescence. There's a lot more turmoil because of this change in the relationship, and parents and teenagers struggle with deciding privileges and responsibilities, okay? So major conflicts can happen, especially from age 15 to 17, okay? It's a suggestion to have parents sit down with their child and together set the limits and the structure together. So you give that teen kind of some input instead of you as parents being the authoritarian still. Okay. Peers are going to kind of still take the position in that child's life as the parent's influence prior to adolescence. So the peer is going to kind of guide what that adolescent is trying to accomplish. Okay. Like I said, it's ideal to speak to adolescents alone. And if parents may have a lot of questions about how to talk with their adolescents about different things such as, you know, sex and all of that, or puberty and such. So it's best to have you as a nurse be a good resource for that person. And you can also encourage the parents to have their child speak with their school nurse if they're not wanting to speak with that child themselves about, you know, these sensitive topics. Okay. HPV, we already talked about that. That prevents different cervical cancers. Okay. And it also has reduced the risk of anal cancers, oral cancers, colon cancers, penile cancers, testicular cancers. It's not just for female cancers. It's lessened the amount of cancers related to HPV across the board. So with adolescents, they're going to be on the go. They're in a lot more activities and such. So they're going to be eating more like gas station foods or to-go foods, fast foods. So you have to discuss with them about, you know, healthy diet choices. Okay. Usually more snacky than having a whole sit-down meal. Okay. Body weight can fluctuate. Okay. So reassure adolescents that this is fairly normal, but obviously if they're having a big swing in their weight upward, then it needs to be discussed that they're, you know, their eating habits and portion control. Okay. If you're concerned about their eating habits or a eating disorder or something, talking about a 24-hour diary of all the foods that they've eaten can be helpful, especially more in kids who are just maybe mindlessly eating because they're stressed or something like that. Showing them what they've eaten over a 24-hour period can be eye-opening to a lot of those kids. But like I said, with the food diaries, sometimes kids who have like anorexia or bulimia, this can be really problematic to them. Sleep and rest, they're having major growth spurts, so they require more sleep. That doesn't always mean that that is what they're able to do because of their coursework and their social activities or their sports. Okay. Still requiring good exercise, you know, at least 5 days a week for an hour or longer. And dental health. So still needing to brush their teeth because they're having these teeth now for the rest of their life. So stressing dental health. Okay. So their social media, I mean, an average of 7 hours a day of screen time is, I would say, probably pretty common in this age group. They're getting their information from TikTok and online and places that aren't accurate. So parents who want to make sure that they're getting the most accurate information specifically related to sexual information should have open communication with their kids or encourage their kids to have conversations with school nurses or, you know, their nurses at their doctor's office or Planned Parenthood, somewhere like that, to get the most accurate information. Okay. So still motor vehicle accidents are the most common form of injury in this age group. Of course, suicide and things like that are also increasing, as well as firearm injuries. Okay. Matt is age 14. He seems to always be eating, although his weight is appropriate for his height. What is the explanation for this? You guys can just say. Anyone?
Is it A?
Yeah, because there's a huge growth that's happening, right? So your parents are gonna feel like their 14-year-olds, especially males, are eating a lot. As long as their height and weight is still continuing to be appropriate, then you don't necessarily worry about them eating more frequently. Okay. Obviously, if they're overeating and their weight is going way up percentile wise, they're going from the 70th percentile to the 98th percentile, then and their height isn't also increasing, then you get very concerned. That's when you have the conversation about growth and making healthy choices. Okay, we have some time. Do we want to do a little bit of the cahoots from week 2 since we didn't get to that last week for the next 15 or so minutes? Yeah, okay, I'll get that pulled up here. Also, if you guys have questions, I can talk with you guys through that. Yes, no? Did you guys get to the cahoots week 1? You did, okay. There's just a lot more information to cover in week 2, so we didn't quite get to it. It's loading here. Not sure why Cahoots isn't wanting to work. Okay, now it's starting to work. So I would encourage you guys to use the PowerPoints to kind of guide your studying. If there's information on the PowerPoint that you guys do not remember from your readings, go back and read that information. Okay. If you're doing the Kahoots and there's information or a question on the Kahoots that you're not understanding, you can either refer back to your PowerPoint or also the book. Okay. Okay, it's finally loading here. Kahoots has been very slow all day today. I'm sorry. Okay. Go ahead and join as soon as that pops up here, and we'll get started. Okay, get started. It's $4.55 for full credit for time. Okay, types of play considered to be sensory play. Playing in sand, finger painting, playing checkers, or playing with mashed potatoes with their fingers. Yes, good. A nurse noticed patches in the mouth of an infant that cannot be removed with a tongue blade. What's your intervention? Okay, what are the white patches?
Thrush.
Yes. Okay, so how do we get rid of thrush?
Nystatin.
Yep, good. Nystatin. So that's that medicine that they'll need. Okay, what type of play is considered to be cooperative play? Yes, playing checkers. Why is it cooperative play?
Because it requires both of them to take turns together.
Yep. And they have the same goal, right? They both want to win. Good. Good. Okay, according to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning, listens to their mother and father, follows the rules, understands actions are either good or bad and have consequences, tries to please others. Yes, understands that actions are either good or bad and that they each have consequences. So that's the moral reasoning for Kohlberg. Okay. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? Give them a diagram, let the parents teach the child, only teach the parents, or use adult to explain the procedure. Yes, good. So use the adult to explain it. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? Parents restrain the child, reward the child, utilize play and let the child touch the equipment, or use minimal physical contact at first. So for toddlers, they won't necessarily, they're still nervous enough about things that usually play is kind of more difficult to get them to participate in. So you are going to want to start with something like talking to them first, or getting the parent involved prior to the play piece. Okay, so minimal contact at first. So get down on their level, start talking with them, gain their trust a little bit before you start assessing them. Because like I said, most of the time, toddlers aren't interested in playing with you right off the bat because they still think that something bad's going to happen. Okay, what would you suspect if you note that an infant's chin is quivering, fists are clenched, and they're inconsolable? Hunger, needs a diaper change, colic, or pain? Yes, pain. Good. Multiple select. Okay, Erickson describes infants as trust versus mistrust. What does trust mean? The infant feels secure. The infant has to cry a long time to get someone's attention. The infant can predict what is coming and that their needs are met, and the infant is calmer, happy child. It's a multiple select. Yep, so the infant feels secure, the infants can predict what is coming and that their needs will be met, and that the child is also more calm and happy. Okay. Good. The infant should not have to cry a long time before their needs are met. Otherwise, if they continually cry and their needs aren't met, then they're going to fall in that mistrust category. Okay, a 3-year-old child is having an outpatient procedure. How would you help the child be less fearful? Explain the child what needs to be done, draw a picture, use a doll. Oh, I must have hit skip, sorry. So it's use a doll and let them see what you're going to do out of these options. That would be what's appropriate for a 3-year-old. Sorry, I clicked the button already. All right, multiple selects. You need to do an assessment on an infant. You walk into the room and the infant is asleep in the mother's arms. What are you going to do? And remember, this is multiple select. Yes, listen to their heart sounds and their lung sounds. Yep. Unfortunately, you have an assessment to do, so you can't come back later, even though the parent would probably prefer that you'd come back later and not wake their kiddo up, but you have to get your nursing stuff done. Okay, we'll do one more question here. Alrighty, when do you switch from formula or breast milk to whole milk? What age is that? 6 months, 12 months, 9 months, 18 months? $12 months. Yep, you wait until a year. Okay. Alrighty, does anyone have any questions? Thoughts? Anything? Next week is your exam. We do it at the beginning of class. Be here early so we can check you all in. Okay. Have your IDs. Make sure stuff's plugged in. You'll need your 2 devices. Okay. Anything else? No? Alrighty, you guys have a good rest of your day, okay?